As news of the COVID-19 pandemic shook the world, Dr. Anne Wyllie's career had primarily focused on testing for the presence of bacteria using saliva samples. Faced with an urgent need for easy and affordable testing, Wyllie joined a group of scientists at Yale School of Public Health and began to investigate saliva as a viable sample type for SARS-CoV-2 detection. Her recent publications include Saliva or nasopharyngeal swab specimens for detection of SARS-CoV-2 and Saliva as a gold standard sample for SARS-CoV-2 detection. In 2021, she was awarded the COVID-19 Research Award from the Yale School of Public Health. We are truly pleased to have you with us, Dr. Anne Wyllie. Thank you, Anne. Okay, great. So let's start today with talking about how you became interested in salivary diagnostics.
Thanks, Susan, for that lovely introduction, and to Thermo Fisher for supporting this important dialogue about saliva as a solution for diagnostics, particularly for SARS-CoV-2 detection. I actually started working with saliva as a sample type during my PhD program at Utrecht in the Netherlands. We were investigating Streptococcus pneumoniae. Pneumococcus, as it's also known, is quite commonly found in our upper respiratory tracts. It's been present in humans for centuries. Though benign for most people most of the time, pneumococcus can cause diseases such as pneumonia and other respiratory tract infections. My research goal was to better understand its true prevalence in the community and what that meant in regards to both disease progression and vaccination strategies. Along the way, we learned that in the early 1900s, saliva was the sample choice for studying pneumococcus, so we thought, why not give it a go? Thanks to a local school and later some older adults in the community, my PhD demonstrated that compared to the gold standard nasopharyngeal swab, saliva is sensitive as a sample type for the detection of pneumococcus in healthy individuals. Importantly, while saliva performed well for participants of all ages, in my research, saliva worked even better in older adults, a particularly vulnerable population to respiratory infectious diseases.
So your early research involved a revival of saliva testing for the detection of a potentially lethal respiratory pathogen in a broad community-based population. I'm seeing a parallel to the SARS-CoV-2.
It's indeed turned out that way, but entering the COVID-19 pandemic, however, I did not immediately expect a use for saliva. Yet, with hospitals around the world relying on nasopharyngeal swabs, we saw the global supply chains collapse. We heard healthcare workers worrying about constant exposure to this new virus. Every day, all day, they're collecting nasopharyngeal swabs, risking being sneezed and coughed on, and sometimes without the proper PPE to protect them. At the same time, patients became increasingly hesitant to get tested due to the discomfort they experienced from nasopharyngeal swabbing. With all this, I couldn't help but wonder if saliva could be a viable testing solution for SARS-CoV-2.
Absolutely. NP swabbing was the only mass SARS-CoV-2 test available worldwide. We needed more options to fully address pandemic-scale testing demands. So as you began researching saliva for SARS-CoV-2 in the early 2020 time period, what obstacles did you face?
So the biggest obstacle in 2020, although my previous research testing hundreds of samples had allowed me to perfect the use of saliva as a sample, in 2020, most labs around the country neither had the same experience nor the skill set that comes from nearly a decade of R&D on saliva. This meant that lab techs didn't necessarily have the go-to methods or protocols in place to effectively and reliably process saliva, whereas my research had taught me a good number of tricks. In particular, I'd already tested my process with many different reagents and found some that worked particularly well, reagents from Thermo Fisher, actually. So early challenges were refining what I already knew about saliva for pandemic conditions. But the biggest and the most important challenge was demonstrating that saliva as a sample holds so much potential for SARS-CoV-2 testing. So for well over a year now, I've been working to highlight how the methods, the protocols, the combination of reagents and PCR technology are all important for ensuring a sensitive and reliable saliva test. That's a big part of what the Saliva Direct team is focused on doing now.
You know, at Thermo Fisher, our mission is to make the world healthier, cleaner, and safer. Knowing Thermo Fisher reagents maximize the Saliva Direct protocol is great news for our listeners. What specifically makes saliva well suited for monitoring infectious diseases?
Well, saliva is actually already well established for other health measures. It's well suited for also monitoring infectious diseases for three main reasons. First, it's incredibly easy to collect saliva from subjects. It doesn't require high-level healthcare workers to take samples, and they've been incredibly stretched thin, as we know. Importantly, saliva can be reliably self-collected by pretty much anyone. This supports at-home collection and helps protect our healthcare workers from exposure and burnout. Second, we've designed the Saliva Direct assay to decrease resource utilization and increase throughput, which is so important for overburdened labs during pandemic conditions. Experienced labs using Saliva Direct reliably produce PCR results within a few hours. Third, we've shown that for SARS-CoV-2, you don't need expensive tubes or buffers or special equipment, and you don't need cold chain transport. So altogether, these attributes make saliva-based tests much less costly than other approaches. And if you're wanting to monitor disease nationally, you need to have sustainable, reliable, low-cost solutions and ones that are not burdensome to the public. Using saliva as a sample with Saliva Direct, for example, can also yield major public health benefits globally, especially in low-resource settings.
So you're saying that saliva as a sample for SARS-CoV-2 testing reduces collection burdens on healthcare providers, improves the patient compliance, speeds the lab throughput, lowers overall costs, and more importantly, detects infections at earlier asymptomatic stages. That means public and private healthcare systems potentially could better detect outbreaks, prevent transmission, and stretch budgets for SARS-CoV-2 testing by including saliva as a sample in their testing portfolio?
Exactly. And public health systems around the world are just beginning to actualize these types of results.
Wow, very, very fascinating. Exciting, too. Diverging now to Twitter. You've referenced being called the spit queen of Yale. Tell us, what can saliva do that nasal swabs can't?
Thanks, Susan. I certainly didn't expect Spit Queen to gain such traction with the media, and in truth, the title was unexpectedly bestowed upon me in a meeting by the Dean of the Yale School of Medicine, Nancy Brown. But honestly, as a sample type, saliva is more democratic than imperial. And to your question, because saliva is so easy to collect, it can actually increase testing compliance, as you noted, while preserving PCR quality detection in many cases, as well as or better than nasal swabs. There's research showing that many individuals prefer giving saliva samples than being swabbed, especially when undergoing testing every week. Interestingly and importantly, a number of studies have found that SARS-CoV-2 can be detected earlier by saliva samples as compared to nasal swabs. We also see that SARS-CoV-2 seems to clear faster from saliva than from nasal swabs. We've all heard how swabs can test PCR positive for up to 90 days or even longer post-SARS-CoV-2 infection. We're just not really seeing this with saliva. And if you look at SARS-CoV-2 detection in saliva and swabs over the course of infection, the virus signal seems to be cleared more rapidly from saliva. This suggests that saliva could give a better representation of the actual clinical infection rather than remnant RNA still shedding later on.
All of this is so compelling, Anne. Why has saliva not been more widely accepted as a sample type?
Well, fortunately, saliva is gaining acceptance daily, but there is no obvious answer to your question. But what I can tell you is decades ago, saliva was actually already widely accepted and widely successful as a sample type in infectious disease studies. During the antibiotic era, research and diagnostic practices shifted. It's not clear why saliva went out of fashion, but it lost its place as a traditional sample type. Then, in the mid-1900s, when I think we started realizing that antibiotics hadn't actually solved everything, infectious disease research was reintroduced, but for some reason using nasopharyngeal swabs. Maybe one reason nasopharyngeal swabs took hold was that infants and children experienced less discomfort during the collection process, unlike adults where it can cause real discomfort or even burning sensations. We also know that many people react strongly to swabs with sneezing and coughing, which is not ideal for infection control. The way I see it, saliva as a sample experienced a big generation gap. What were once standard practices for properly processing saliva have just fallen out of use. And modern processes for nasopharyngeal swabs don't always work well for saliva. Saliva requires sample-specific handling. You wouldn't use a swab-based protocol to process a blood sample, for example. You need to account for the different composition of blood samples and process accordingly. In line with that, if you received a urine sample, you choose a test specifically designed for that. You simply shouldn't just take a method that works for swabs, apply it to saliva, and expect it to work. They are different sample types. This is why many labs have failed to get useful results from saliva. We do need to focus on the labs that have found effective methods for processing saliva for reliable SARS-CoV-2 detection. We should be focusing on and further developing those successful methods.
What is the future of saliva beyond the COVID pandemic?
This is definitely just the start for saliva. The ease of sample collection and how much cheaper it can be to do really opens up options for more streamlined testing paradigms. I really see its great value in clinical research, which so often suffers from limited funds. This would really help make those funds go further and help us learn even more about how common infectious diseases circulate within our communities.
Interesting. What are some of the challenges you see for the future of saliva testing?
Currently, the biggest challenge is sourcing saliva samples positive for other target diseases we may want to detect. To do this, you need to have the sample, which is considered the gold standard for that disease, together with a saliva sample taken from the same patient at the same time. There are currently so few cases of other respiratory disease infections circulating in our communities, such as influenza, for example, that while that is of course great news for public health, for us in the lab, it's been hard to get these samples and further develop saliva. Also, through the pandemic, we've seen that saliva is being held up to much greater scrutiny for validation. Anterior nasal swabs, the ones that go only a little way up your nose, if we take those for example, they were already known in diagnostics to be less sensitive than the gold standard nasopharyngeal swab. But somehow, anterior nasal swabs have been much more rapidly accepted than saliva, and we've actually proven that certain saliva-based tests to be at least as sensitive as nasopharyngeal swabs when used properly.
What are you cautious about when it comes to using saliva as a sample type? And what are you hopeful for about saliva as a sample type?
For the first part of your question, I'm cautious and concerned about misinformation. I'm stunned by the amount of misinformed conclusions circulating in the literature and the media. The culprits are hastily and poorly designed studies. Either saliva is not being collected properly, or is not being processed properly, or the study population is neither properly described nor adequately controlled. And in the race to contain COVID-19, many reviewers are not recognizing study flaws, allowing the publications of incomplete conclusions, which has led to an array of discrepant findings. But on the other hand, I'm also optimistic. I'm hopeful about the solid work being accomplished in my lab at Yale, of course, as well as in many others. We need to share, publish, and implement properly validated methods for saliva testing. Worldwide, the laboratory community is passionate about patients. We've developed proven saliva-based methods that detect SARS-CoV-2 reliably without missing positive cases.
And what is currently inspiring your research today? If you had unlimited resources, what would you do next?
Oh, next. I'm excited about just what else we can learn when using saliva as a sample type. Being so easy to collect, we can use saliva in research to better understand what goes on in the community before disease cases end up at the hospital. With unlimited research, I definitely expand our research in salivary diagnostics for other infectious diseases, but also for preventative health. We've seen how easy it is to set up testing programs and how amenable people are to give a saliva sample. It would be great if we could provide a way to save people from having to travel to clinics when they're ill, or encouraging more people to do more regular screening. I'd probably invest further in implementation of saliva-based testing within our communities, particularly for underserved patient populations. This starts in the lab, of course. In a perfect world, all public health labs would have a protocol in place, allowing them to scale up saliva-based testing when needed. Also, as a country, we must be supportive of the new public health habit of frequent COVID-19 testing. This will require public service education campaigns and significant community leadership so people understand that even when vaccinated, they can still catch and potentially transmit SARS-CoV-2. A key component to resolving this and future pandemics is testing either for pathogen surveillance or for the rapid ramp-up of testing in response to outbreaks, and for this, saliva is an excellent solution.
Great to hear. Thank you so much for your time today.
Thank you so much for having me.
I actually was especially appreciated hearing about the challenges that inspired you and your team to so quickly develop a way to use saliva as a good alternative to meet the enormous demands for COVID-19 testing over the last 18 months. It's incredible that working under the pressure in the midst of a pandemic, the solution you and your team came up with circumvented the swab supply chain challenges and simultaneously made people and healthcare workers safer while they were getting their COVID-19 tests done.
Thanks, Susan. It's certainly been a massive collaborative effort right across the board between academic, industry, hospitals, and I think it's just been so inspiring to see what we've all been able to achieve, as you say, like so quickly when all working together. I'm really excited to see what we can take from what we've learned, whether it's the development in salivary diagnostics or even how collaborative we can be to drive innovation forward.
Exactly. I was thinking that saliva-based testing is going to remain with us. And it's also really great to hear your optimism about the future of salivary diagnostics. There is yet work to be done, though, right?
Yeah, there definitely is. But it's certainly excited to know about just, how this can transform potentially clinical diagnostics going forward.
Truly. And we look forward to following the innovative solutions that come from your research in the very near future.
Thanks again. Proud to, thank you very much.
Yeah, thank you for taking the time to share your insights with us.
No problem. Thank you for having me.
So with that, we thank you all for joining us for this podcast and close the session now.